Hello, everybody. Welcome to today's Global Goods webinar, talking around effective advocacy strategies for community health workers and OpenHIE architecture specifications. So as we wait for people to join, feel free to respond to our fun icebreaker question as we give 5 minutes to have the participant join it. Going to the webinar. Also, as you join in, feel free to introduce yourself. Let us know where you're from, which organization you represent, and of course, an answer to our fun icebreaker question. I see a lot of nice answers coming in. Seashell, small town in the middle of South Africa called Kempton. That sounds interesting. Oh, Iceland. Yes, Mombasa, Kenya, anytime for me. For those just joining, welcome to our Global Goods webinar today. We'll be going through effective advocacy strategies for community health workers and OpenHIE architecture specifications. Feel free to introduce yourself and drop a response to the icebreaker question as we give 2 more minutes for us to begin. Okay, thank you all for your introductions and your responses to our icebreaker question. And now I think we can jump into our webinar for the day. This is the second series of this webinar. So welcome everybody to our webinar on community advocacy strategies and exploring OpenHIE architecture. We're thrilled to have you join us today as we dive into these crucial topics. Whether you're passionate about empowering community health workers or eager to understand the intricacies of OpenHIE architecture, you're in the right place. So joining us today are experts from Stanford's Digital Medic team and Regenstrief. They'll guide us through the pertinent topics. So get ready for an enlightening and engaging session filled with valuable insights and practical knowledge as we embark on this journey together. So just to introduce the Stanford Digital team, we have to introduce the Stanford Digital Medic team, allow me to introduce our esteemed speakers today who will be taking us through advocacy strategies for community health. So we have Nofi Job, who's a research analyst, Victoria Ward, who's a medical director, Caroline Faith, community health work engagement lead, Pauline Pichot, who's an executive director, and Semay Johnston, who's the Learning Experience Director. So without further ado, I'll stop sharing my screen and hand it over to the Stanford Digital Medic team.
Thank you very much. Kat will share her screen. My name is Nopiwe. As said, I'm Nopiwe Job, and I am based in Cape Town, South Africa. So whoever was hoping to come to Cape Town, you are more than welcome. We'll be talking to you today about a training course that we designed together with community health workers from member organizations of SHIC. SHIC will introduce itself just shortly, but it is a coalition and it has member organizations that have community health workers from across the region. And we worked with those community health workers actually to develop and refine the curriculum, this curriculum, advocacy curriculum for community health workers. I'll tell you a little bit about Digital Medic. Let's move on to the next slide. Digital Medic was founded in 2016. It's an initiative by the Stanford Center for Health Education. So we are a team of clinicians, global health researchers, education experts, and designers. We have offices both in California, in Stanford, and in Cape Town. Our mission is to create engaging, high-need digital health education that can scale quickly and cost-effectively to communities worldwide. So our expertise is really in translating complex health information into rich learning experiences that resonate with learners across different backgrounds and literacy levels. We focus on high-need health issues affecting communities around the world, and we work as we're stating on the slide, we're really working towards a world where all communities have access to engaging, evidence-based, actionable health information. We work a lot with partners and collaborators globally, and this really enables us to design and produce credible and relevant materials for learners across health fields. We work in these strategic collaborations worldwide to create this health information for frontline healthcare workers. We don't just create it, but we also evaluate it. These could be frontline workers ranging from community health workers, other health professionals, and to the general public. So our material can be accessed through our app, the Digital Medic app, which we'll talk more about later. But yeah, that's who we are. I'm going to hand over to Carolyn from SHIC to introduce SHIC, who we worked with to create this.
Thank you so much, Nopiwe. My name is Caroline Faith Wanyonyi, the CHW Engagement Manager at SHIC. I'll take this opportunity to introduce SHIC and the pillars that we operate with. Community Health Impact Coalition was founded in 2019, and it includes thousands of community health workers and dozens of health organizations in 60+ countries across 5 World Health Organization regions. We all know that community health workers have been a global cornerstone of primary healthcare for a century. Community Health Impact Coalition is making professional community health workers the norm worldwide. How do we do it? We do it through research. We equip international norm setters with evidence to create professional community health worker guidelines. And this is done by publishing joint studies. We provide technical expertise for professional community health worker guidelines. We also distribute a research roundup. Our second pillar is Advocate. Through Advocate, we are able to influence global financing institutions to increase professional community health worker funding. And we do this by building stakeholder awareness and influencing the professional community health worker movement at both global and regional levels. We also drive uptake of professional community health worker priorities among global norm setters and funders. And one thing that we do under Advocate is also tracking and effecting investments in professional community health workers. Our third pillar, where I belong and my heart loves most, is the Activate. through Activate Pillar, we mobilize in-country networks that win national professional community health worker policies. And this is led by dozens of community health workers, some of whom I've seen on this call. And how do we do it? We train and connect community health worker advocates with opportunities for action and track and effect national professional policy change. We also seed national NGO coalitions and CHW associations. Our materials can be found at the link shown below. Thank you. Next slide. Yes, we all know that historically community health workers have been excluded from discussions and decision-making processes concerning their profession and even the patients that they serve. One thing we have research has proven is that 2 to 4 times community health workers who are trained are 2 to 4 times likely to influence change and discussions, policy and guidelines, including funding, in discussions that they are involved in. So we created this advocacy training alongside community health workers. So far, we have seen tremendous change, and I know you'll be taken through the modules that the community health workers have gone through. Since the inception of this training, a lot has happened. And just to state a few, that this training has impacted community health workers in very many ways. It has enhanced their abilities to advocate, communicate, and lead effectively within their communities. It has provided a deep dive into healthcare policies and community needs. The training has also equipped the CHWs with knowledge and guidelines to solve complex health system issues and also building robust relationships within their health entities, which is crucial for sustainability of health initiatives. Having said that, this course has boosted the confidence of many community health workers who have gone through it. They are able to navigate through complex systems. It has empowered them with knowledge on how to design and implement health interventions for the specific needs of the communities that they serve. It has led to change and improved outcomes within the facilities and thus uptake of services. Furthermore, this training has influenced policy change, making national level through health worker associations, amplifying the impact of public health. And this will be shared by one of the CHWs on board. Thank you. Next.
I'm Vicki Ward, I'm the medical director for Digital Medic, and I'm just going to talk a little bit about the specifics of the modules that are a part of this curriculum. So the first module really talks about the history of CHW programs and community health systems. It uses examples and key questions to ask to make sure that the programs are more impactful, that the CHWs learn about and work on. The second is about the specific steps of advocacy to build support for a cause that is important to the viewer. So if a CHW feels that it's important to get better pay or to get supportive supervision, or they identify that they need better vaccine supply in the community, this is the part of the curriculum that's a step-by-step guide on how to advocate for these things, to elevate them and their importance and to gather more support in the community for those issues. The third is about storytelling. So building confidence for a person to use their own stories to inspire others to act and support the issue. And the fourth is about technology tools. So how do we use things like this Zoom call to be a part of community health conversations globally, or how to use events to promote those causes that's important to them. Throughout the course, there are assessments to make sure that people are both learning and identifying areas that they can go back to learn more. And at the end, there's a certificate of completion. And one of the big things that we've really been excited about is that it also is building community connections. So the CHW Advocates WhatsApp group is a hot place to be and very active. And I think sort of above all, this has been elevating the idea that community health workers are advocates in their community. We all know that. And I think just building the skill set to be able to do that together. I will turn it over to Simi to talk about the specifics of the technology tools. But I just wanted to say before we do that, that this curriculum was built with CHWs in communities. We had many meetings with CHWs to co-create this curriculum. What are other areas that needed to be talked about? How do the specifics of the visuals seem to them? And it was really built together. I think we all feel it's really important to make sure that that curriculum both feels like their own, but also that we make sure that the issues are aligned with what's important to them. I'll turn it over to Simi now.
Thanks, Vicki. Yeah, so as Vicki mentioned, we designed the course to be adaptable in a few ways, and one of the ways was through the visual style and the animation style used throughout. So this was developed with the Community Advisory Board, which I think we have some of the members on the call today, but they helped us to design the host of the course and the visuals so that it could be translated more easily into different languages. So as you saw in the previous slide, we've already adapted it, translated it into 4 other languages, and this is a full adaptation. You know, it doesn't feel like it's just dubbed in another language. And so we really appreciate all of that input to know that we are reaching in a meaningful way as many people as we can. I also wanted to talk about the learning formats that it can support. So we wanted this to be useful for people in a variety of contexts. The full course can be accessed by individual learners, and this can be done online or offline using the Chic web portal or the web app, as well as our digital medic app. This can be done at your own pace. You can go back for refreshers if you want to go back to a single item. There are downloadable templates to work through designing your own story and things like that. Then there's also the hybrid group training format that can be used. So we also developed a facilitator guide and a student guide that can be used as a reference for an in-person hybrid experience where you can customize this for your organization. All of the digital assets can be downloaded through the Digital Medic website, and I've got that linked here. We've also compiled all of the different formats where you can access the content. So by downloading those digital assets, you can incorporate them into your training however it fits best. And we really want people to just use it as makes sense for them. So to that end, all of the assets have the Creative Commons license, which is the, it's always a mouthful for me, the Creative Commons non-commercial attribution, non-commercial share alike. So you can make changes to it, but maintaining the attribution and sharing. And as always, we'd love to hear how this is being used. So if you can keep us in the loop about where you're sharing the course, how you're using it, and we hope that it's making an impact for you. I will. I think we can move on to the impact, and I know we have Nabwagama Habiba from us, or Caroline. I don't know if you want to say a few things on the high level impact first.
I think we can pass it on to Pauline, and Pauline actually is with Habiba. She'll pass it on there. But Pauline, over to you. Pauline is a partner from Nama Wellness Center, and yeah, she's from Uganda. Pauline, take it away.
Thank you so much, Nopiwe. Thank you, everyone. My name is Pauline Picho from Nama Wellness Community Center. and we actually rolled out this course in country. We, as an organization, are surprised with what's happening in terms of uptake of the course across the country. The course came by during COVID-19 when we were all thinking of solutions on how to respond to the pandemic. And for us, our solution at that time was CHWs, working with CHWs who are paid, who are trained, who are well supervised and linked to government health centers. And therefore, when we saw this course, we saw it as an opportunity to build the capacity of VHTs, or community health workers, as we call it globally, to go out there and support their community members. So we piloted it in at district level with our district health team. They were so happy about it. So after that piloting, they took up the course. They gave us feedback, which we shared with the team at Digital Medic. They used that feedback to improve the course, and we use this to actually train about 100 CHWs in our country. And at that time, the government was implementing the community engagement strategy. And this community engagement strategy actually required a CHW to attend village meetings almost every 2 weeks or every month. It required the CHW to go to homes and implement COVID activities using the home-based care. So without this information, it would have been very difficult for the CHW to sit in the meetings and share their experience and share the challenges that the community experiencing, and coming together with a solution together with the rest of the community members. So the training really helped them to do that. And then after training the 100 CHWs, we went to national level, started sharing the course in different meetings at Ministry of Health. And surprisingly, they were so excited about it. And we took that as an opportunity to actually have that course incorporated into the curriculum for CHWs, for training CHWs in the country. And right now, we have trained over 5,300 CHWs in the country in about 10 districts now. We are really so grateful for the support that we received from Community Health Impact Coalition. They were able to facilitate the printing of these books because we did this course in classroom. So we printed the books, and this is what we were using in classroom to train the CHWs. And we were also able to train about 176 sub-county trainers. Still Chic and Digital Medic came in and trained about 45 national trainers to be able to go out and train CHWs in the whole country. So we are really very excited about this. We've seen the impact our CHWs have created in the community, because their ability to go out and knock at everyone's door, tell them that I've come to treat your child for pneumonia, I've come to assess your child for malnutrition, I've come to treat your child for diarrhea, has actually gone high. And also, in addition to that, the CHWs sit in meetings, conduct health education in groups, and they're not shy, they have confidence, they're able to talk and speak out to the community. So we are really, really very appreciative of that. And most of all, very appreciative that the Ministry of Health Uganda was able to collaborate with us to launch this course in the country, which was actually supported by Stanford Center for Health Education and Digital Medic. And she, Caroline, came in Uganda and was part of that team that was doing the launch and signed off the book. So we're really very excited about that. And therefore, in Uganda, we've embraced the course. And also it helped us understand how CHWs are valued in country. They are loved. The only challenge here are resources. If resources were available, I'm sure they would be paid, they would be trained, comprehensively as expected. So we are really very grateful. And I'm here with one of the CHWs. I'll turn over the microphone to her to share her experience. Thank you so much for this opportunity.
Hello, everyone. I'm Nawegamo Habiba, a CHW from Mukono District, Uganda. I'm supported by Nama Wellness Community Center. I attended an in-class training in 2022 and later did my online course, which I found interesting. With the knowledge I gained, I joined the X and won the Viber Challenge in August 2023. I became part of the advocates group on WhatsApp. I enjoy learning from my fellow CHW and helping them to access the course content, especially about using social media for advocacy. I'm now more confident to speak. I'm now more confident speaking to larger groups and in virtual meetings. I'm proud to be a CHW and committed to advocate for better working conditions until when we are supplied, skilled, supervised and paid. Thank you for your support. Nothing about us without us.
Abiba, thank you so very much. Friends, we are ready to take on your questions. We just have here on the screen a QR code you can follow. My friends have already let you know how you can access it. We have an app. There's also a progressive web app by Chic. The link is shared in the chat by Carolyn. You can get it on our app. You can get it on our website as well. You can also have access to the learner guide and the facilitator guide, which you can use if you are doing in-person training. That Time has already explained. You can chop and change as much as you want based on how training is conducted in country. But we'll take questions now. Thank you.
Hi there. I'll jump in with the first question, and apologies, I'm a bit croaky today. But first of all, thank you so much. That was an excellent presentation, and it was so good to hear from a range of you, and some very impressive impact stats as well. My question is about the language internationalization. So it's great to see that you've already got 3, and soon there'll be 4 languages available. So can you maybe just elaborate a little bit on what it would take, what sort of level of effort, what is needed, what is the process to be able to take those materials and then to translate it into another language and have it quality assured?
So I can answer that. We have all of the scripts for the videos, as well as the on-screen text and the written materials, all organized in a way that makes it pretty easy to translate. So the main steps would be translating it, and making sure that native speakers can verify the translation is meaningful and makes sense. And then it goes into voiceover recording and animation. So the way that we've designed it, since it's not filmed live, you don't have to start from scratch. We have our narrator, whose name is Sarah, which you saw on the cover of the facilitator guide. We can feed in the voiceover recording and re-render the footage. So it's a little bit of time to produce and edit all of the translated text in, but it's much faster than going from the start. So that would also go through maybe a round of just QA to make sure that the translations and everything is being done. Usually our editors are not fluent in the languages that we're producing them in. So they're following along with the English and the written translation. I hope that answered your question.
It did. No, thank you. That was very helpful. If you don't mind, I've just got one quick follow-up, and then I'll hand it back to everyone else. And that is because I know these are openly licensed tools, and anyone can actually take them and adapt them. Do you have a formal process for people who've maybe done that to actually resubmit it back to your sort of repository to be able to share it more widely?
We don't have a formal process, but we would love to hear how you're using it. So you can email us digitalmedic. Sorry, let me put the email in the chat, or reach out to Sheik also to share. I think we would love to get resources out as much as possible. And yeah, I think that would be wonderful. I think some of the limitations are around funding for additional language translations, and we love to work together and share what's being made.
Great, thank you.
Thank you. If we have no further questions, thank you so much, Stanford Medic, for the Digital Medic team for that presentation. It was very insightful. It's clear that empowering community health workers is crucial for advancing healthcare at the grassroots level, and that training offers that. Sorry, am I coming out clearly? I'm hearing some interference.
You are clear. Thank you. You're good.
Oh, thank you. Okay, so without further ado, we'll go to the second part of our presentation. So I'd like to introduce our speaker. So her name is Jennifer Shivers from Registry. She's a strategic technical advisor. And a fun fact about Jennifer is that she's learning about native plants and excited to see the ones that she's planted begin to emerge. That sounds exciting, Jennifer, and I hope it fulfills what you expected. So without further ado, we can go into OpenHIE architecture specifications. I will stop sharing my screen and hand it over to you, Jennifer. Thank you.
Thank you very much. While I try to share my screen here, I will also try to introduce myself. Hi, I am Jennifer Shivers, and I have worked at Regenstrief for about 10 years. And I work on OpenHIE as well as other projects. My goal here today, I'm hoping you all can see my screen now. My goal here today is just to share a little bit about OpenHIE as a global good. Most of you probably have heard of OpenHIE, but may not know much about what it means as a global good. I know there's often confusion about, is OpenHIE a piece of software? So I'll just open that up at the very beginning and say, actually, OpenHIE is a collaborative community, and we'll talk about that a little bit more. And we focus on health information exchange. And so what do we mean when we say OpenHIE? I think I mentioned a few of these words just a second ago. So open, we also have a Creative Commons license for everything that is produced by the community. And that means that anyone can use, reuse our materials. And I'll talk a little bit more about that as we talk about what the materials are. I did mention that we're focused on health information exchange. And as I talk about what it means for us to be a global good, we are a content global good, which means that I'll be sharing some of the ways that we have content as a community. All of our work is created by the community with input and thought from the community. And so we work together to basically harvest information from all the participants. This is a picture, I think, from a global meeting we had in Ethiopia. We've had a couple of other meetings since then, but really when we say community, what that means is walking and learning together. And we do this by sharing with each other and then trying to take that information that's shared and harvest it back into materials. Some of the community members are funders who participate in our community. We also have universities, NGOs, and ministries of health as well. And so one way we can think about the community is really thinking about it as an architectured approach, including standards, but really I think I've probably said the word community at least 4 times, and maybe we should have played a game on how many times I'll say it in the presentation. But it's really the people that help drive OpenHIE and create these patterns that we see. So this is the OpenHIE architecture diagram. And as you can see, it really starts with their point of service applications that might be being used by community health workers, those at a lab, a pharmacy, or those who are actually at a healthcare facility. And so down here are the point of service applications. We have a layer where the data goes through what we call an interoperability layer and uses various registries that focus on products, the health workers, facilities, patients, or the clients, and also focuses on terminology. So that's kind of what I'll say about the diagram, but I'd really like to talk a little bit more about the global goods that we have. Oh, yes, and the people part. So I mentioned that we have like this feedback loop. And so what we really try to do is make sure that we understand the real world uses. What's driving information exchange? What information do people want to share? And we do collaborative learning on that. Then from that learning, we identify patterns, and then we create documents that can include training and the architecture specification, which I'll share in a minute, that document those patterns and practices. And then those practices can be used to influence change and influence those real world patterns, which again would then allow us to update the materials. And so this is the feedback loop that we work to support and use to help us move forward in identifying community needs and documenting those. So we have several global good resources. And so when we say OpenHIE, we think of not only the people, but some of these resources. And these resources can be used at different times as an implementation organization or a Ministry of Health is going through a project. So we have an architecture specification, a getting started guide, academy courses. We have a community that showcases how people are doing things, the challenges they're facing, and how they solve them. And then as people begin to share what they've done, we have impact stories, which help people learn what happened or is happening, or how other countries have made progress in health information exchange. We are also working on other ways to document success. One of this is by having a country health information exchange profile. This is something new where countries are beginning to capture how they are exchanging and sharing information. And then we also have field notes. And I just realized that I did not share the link for this presentation. So I'm going to jump out and see if I can put that in the chat here. I can find the chat. So that you can click on any of these links as I'm trying to share. All right. Sorry about that for not doing that earlier. But anyway, these are links that we have. The country profiles are helping us understand how a country is progressing with health information exchange, and the field notes are basically like a log on what countries have presented about what HIE components, when they presented or shared, and what the status of that component or project is. And so you can look at that log and see how different countries are moving forward with health information exchange. So for example, if you wanted to see what all countries are working on a client registry, you could sort that table on that resource by client registry, or you can sort it by country and see what's happening. But today I'll highlight a couple of global goods. The first one I mentioned is the architecture specification. I think if you think about OpenHIE, this might be one of the things that you think about. And this can be used in all three phases of a project, when you're planning, when you're implementing, and maybe even when you're demonstrating or showing health outcomes. And the architecture specification contains three main components. This first one is the HIE diagram. And so this kind of shares what the components are that we expect in a health information exchange, and shows how they fit together in this large diagram. Next, we have, for each one of those components, we have functional requirements, and this can be used by implementers as they're trying to select tools and or build tools. They can look at what we're describing as a community of the most important requirements that a piece of software should have. The third thing you'll find in this content global good is data exchange patterns. And so this really shows like not only how we expect the data to flow from a point of service application through the interoperability to the registry, in this case, the client registry. So this shows how we expect the data to flow, but you can also find data in the specification that show you the standards that are recommended, and actually provide links to those standards, whether they're HL7 fire or whether they're HL7 V3 transactions. You can find the documentation to those. And so this is very helpful as you're actually building or implementing data sharing between your components, because this recommends where do you start with thinking about standards for messaging. And you can find all that information in there and links to that information. The next global good that I will highlight is an academy. This is used basically in both planning, because it helps you understand the terminology that's used, and it helps you understand the basics about data standards. If you are somebody who may be new to health information exchange or new to global health informatics, this provides a basic foundation. And then, like I said, there's also help in here for implementing, because some of the courses can be technical. We have our own courses that are branded using OpenHIE. And then we also have other courses. I forgot on the specification, I forgot to talk about language. We have the specification available in English, Spanish, and French. For these courses right now, everything is in English, but we are just now kicking off a project to translate some of the key courses into multiple languages. We are working with a translation organization to do that work alongside us, and then we will load those back into the academy so that they will be available. We also like to partner with others to link their courses in when appropriate. So you'll see this is actually a course that focuses on the global goods videos that Tech Change has done. And so we try to point to others for resources as well. Our main audience for this, again, would be those who are wanting to learn about health information exchange. And most of the courses, especially the ones branded under OpenHIE, are aimed at a general audience, no computer science degree needed, but it provides a foundation so that everyone can understand the basics of interoperability and standards. Here's just a little bit on impact. So, and I realize this graphic is small, but for some of the courses we have here, like since we've just launched in 2021, so how many people have taken those courses? And then if you take a certain selection of courses, you don't actually have to take the courses, but anyone can also take what we call a foundation certification. This is everything in the academy is free except for this certification. Our stakeholders recommended that we charge a small fee for this. And we have it so that you can take a test that says that you understand the basics of the components, the basics of health information exchange, and the basics of the reasoning for using standards and what some of those standards are, and then how to apply them in a business case. So for example, what components would you need to be able to support case reporting or a question like that. So this test then kind of helps make sure that we understand that there is a larger group out there that is understanding the basics of health information exchange. One of our other things that we do, this isn't necessarily a written down global good, but we do have conversations and we document those conversations so that that is available to the community. And so the implementer network is a way for countries to do really focuses on this third step, where a country can demonstrate how they have improved health outcomes, also share experience and what they would like to do better or learn from next time. And then that in turn helps those who are planning and implementing. All the information from those presentations is available, and the recordings of the meetings are available so that people can watch and learn at their own pace as needed. And then also we have global community meetings, and we've had it in Ethiopia and Tanzania and Malawi in the past, and we are working towards Sri Lanka for this year. So that's a place, again, where there's lots of networking and sharing of experience to help everyone as they try to work on health equity. We would love for you to come walk with us. And here's our mailing list and a link. And I think that was the main thing I had to share. I think one other thing that I just want to say as a reminder, everything we have in the community is under the Creative Commons license. And then as far as impact overall, I think what we're seeing and we're trying to quantify by some of those things I mentioned, such as the profiles of how countries are progressing with HIE and the field notes and the impact stories. We're trying to document how countries are moving along, and we're working toward better gathering that impact. But we do know that how many people participate in the different meetings and things like that. But that's some of the impact that we're working on quantifying right now. So that's what I had to share. I am definitely open for questions if anyone would like to ask any. Okay, well, I shared the presentation and there are lots of links to resources in there. I do see Linda, at least one of the Lindas, hand.
Hi. Yeah, sorry about that. And it is me again. I can never pass up a good opportunity to ask questions. And actually, this is less a question, but maybe also just a clarification. And that is, I've found, over the years, many people who are not that familiar or very new to the OpenHIE community, take a look at that architecture specification diagram, and believe that you need to implement everything, all of those components and workflows pretty much at the same time. Can you maybe just elaborate on that misconception a little bit?
Yeah, so specifically, if you click on that slide that I had that had a list of all the global goods and when you could use them, there were two particular things in there: field notes and country profiles. The country profiles was where we're trying to show where countries are starting with health information exchange. One common place to start is by doing a facility registry, which is like understanding and naming your facilities the same thing. I think this is a common place that people start because to do some of your HMIS reporting or your PEPFAR metrics or whatever, it's often very important to be able to call facilities the same thing so that you can begin to merge and use data. And so really the whole OpenHIE architecture is designed to help you with data sharing problems. So that's one way that we see people start is with a particular registry. Another way that we see people start is with a particular problem, like I want to be able to do case reporting from my EMR to a central repository who's going to look at, overall population health. And so what does what components do you need for that? And how would you start with that is another way that people start is with a particular problem. Another particular problem like that could be, I want to share data, like my patient population moves from facility to facility, and it's hard to see a treatment plan or how a patient has been served at another facility. So that data sharing problem, you probably need a shared health record, and you would start with thinking about patient identity and identifying patients across facilities. And then how can you have a shared health record where you can share basic treatment information across facilities? And so you could start with a problem. So those are two particular ways to start. We also know that people start with a blueprint of like what might be our plan. And if you look at many of those blueprints, you'll see a resemblance to the OpenHIE architecture diagram, where they have that interoperability layer in between the services that are happening out in the field and then the central registries that help with that centralized data. Thanks for that question, Linda. Any other questions? Okay, well, everyone is on a journey, and we invite any of you to join us as we all travel along that path to increase health through health information exchange. Thank you.
Thank you for that, Jennifer. So that concludes our webinar for today. We've provided invaluable insights to both community advocacy strategies for community health workers, and we've deep dived into the OpenHIE architecture specifications. We've explored empowering the community health workers to amplify their voices and promote essential health issues in their communities. It was nice to hear from Nagaremo about her experience and her journey. We've also seen the importance of interoperable health information systems in advancing healthcare delivery. So let's take what we've learned today and continue our efforts to empower the frontline healthcare providers and improve healthcare access and outcomes for all. We will be sharing later after this webinar, we'll share the presentations that have been presented today by Regenstrief and Digital Medic, and also let you know what's planned for the next webinar in this series. So that's all from my side. Linda, do you have anything to conclude before we close this?
I think just to say thank you once again to our wonderful presenters. They were both really excellent presentations. And yeah, thank you so much. And we will be sharing everything with the community going forward.
Well, thank you, everybody, and have a great day, or evening, or morning.